Hi guys, my name is David Allerid. This is my first video discussion board for medical anthropology with Professor Barbara Hurst, and the video that I'm going over is Sick Around the World. The first country we got to visit in this video was Britain, where the tax revenue is used to pay for the National Health Service, which led to having government-owned hospitals. Some of the reasons why Americans might not appreciate the British healthcare system is because there is way too much government involvement for their level of comfortability. Another reason that Americans don't favor the British system is because they would not like higher tax rates. British doctors have a strong incentive to keep patients healthy due to a bonus of about $180,000 a year that they receive. Also, I believe it has to do with the competition of hospitals due to patients being able to choose the hospital of their choice. The next country our foreign correspondent visited was Japan, which has its inhabitants sign up for a healthcare insurance policy through work or school, and for people that do not have the financial means to pay for the policy, the government pays for them to receive insurance and to receive healthcare. The Japanese are able to keep their medical procedures low by having their Ministry of Health negotiate prices for each procedure and or drug and ensure the price is the same everywhere. If a doctor tries to increase the price of a procedure, the next time the Ministry of Health negotiates prices, they lower that price of the specific procedure. Some interesting benefits for the users of the system are that you never need an appointment, you can go in and see a doctor for 33 minutes. They also love technology, so they have about twice as many MRIs per capita as the US. Some ways that the regulation of Japanese health insurance is different than the US health insurance is that doctors can only charge what the official price book says. If one loses their job, they switch to a community insurance plan, which cannot turn down someone who is sick and cannot make a profit. The average premium there is about $288 per month for a family, and the good thing is that your employer pays for half. Next on his travel was Germany, which goes by the Bismarck model, which says that the government must provide the basic mechanisms so all of its people can get Medicare when it is needed. The basics that the Bismarck model covers is mental, surgical, dental, and they will even send you to a spa if you're tired. Some ways the German model is different than the US model for healthcare is that it costs a fraction of what US costs are, and prescriptions are covered with a minimal copay. Also, due to lower costs than the US, the doctors there make about half of what they make in the States. Germans are able to keep their medical costs down thanks to sickness funds that negotiate standard prices with medical providers to ensure that they are as low as possible. Next was Taiwan, which is a small country which has increased their wealth in the past 20 years. And in 1995, this increase in wealth led them to want a healthcare system that represented their growing wealth and thriving economy. They set up a committee, consulted healthcare economists to consider all countries around the world and incorporate them into a model that would work for them. The Taiwanese decided not to copy the US due to the fact that they strongly believed it was not a system as much as it was a market. Some things that have been working well in the system is that there is only one government insurance collecting money and no chance to opt out. Also, the fact that there is not a gatekeeper, meaning that they could see a specialist with their problem almost immediately. The most advanced technology that they have is a smart card, and it gives all health related information to doctors as well as allows them to directly bill charges to the government for their patients. Taiwan, though, is struggling to balance the hopes of patients, needs of doctors, and cost of treatment because they do not make enough money to pay for services and spend only about 6% of the total GDP on healthcare. Politicians have been weary to raise premiums due to the fact that they believe voters will not back them if they do, which has caused government to borrow from banks. Lastly, on his trip, he visited Switzerland, that up until about 1995 had a very similar healthcare system to the US. Switzerland made the change hesitantly by only voting a few percentage points higher for a comprehensive medical package, for all due to the possibility of losing health insurance by losing your job. The new system, Lamal, was non-profit on basic care and did not allow providers to cherry pick the young and healthy to avoid the old and sick. Also, that the people who refused coverage were forced to pay monthly bills and were assigned to an insurance company. Swiss people were willing to make this change because they believed and eventually believed that the universal healthcare is a basic human right. The Swiss have now become more supportive of Lamal because they witness and realize what a positive impact really is of having universal healthcare. After watching this film, I probably have to say that the positive impacts that healthcare reform has had on all these wonderful, powerful, and strong countries, I think it really makes me want to push and call my senators that we need to have universal healthcare. A couple days ago, Bernie Sanders introduced it to us, and it should be continued to be pursued and fought for because universal healthcare is a right, and we should not have to go bankrupt every time we have a health emergency. Thanks, guys.